Hey all, how are you do? My name is Maru Quintero. I am with NC Counts Coalition, and this is Shine a Light, or as we say it in Spanish, Voces que Iluminan. Today, we are with one of our members. I will let her introduce herself, the organizations, the community that they work with, and the impact that they do in a daily basis. So today, I have Miss Debra Allen. Please, Miss Debra, thank you for being with us. Please introduce yourself and the organization that you are with.
Thank you so much. I am Debra Allen, and I am the executive director of EBC-ATOM, and that's ATOM, and it stands for a Total Outreach Ministry Project. We're located in Rocky Mount, North Carolina, and this is the nonprofit arm of our church. And we've been there since 1998.
Wow. Wow. So you mentioned that it's part of a church. So can you tell us a story? What drive you to create the organization?
Sure. EBC Adam was the brainchild of our late pastor, who actually just passed last year, the Reverend Dr. Thomas L. Walker. And he had this vision of a community based church that would reach out to meet the needs of the community. And I think through the years, we've been known as that community church. In 1998, he convened 9 leaders, and we talked about forming this nonprofit that would be of service to the community. It was designed to focus on the spiritual, emotional, economical, and cultural needs of the community, for especially with a focus on moderate to low income individuals. And that's how we started 1998. And right after the organization was formed, we had Hurricane Floyd, and then we had Flood Floyd, which if you're in this area, you'll hear more about Flood Floyd than hurricane, because it was the flood that actually ravaged our area and devastated so many people. So at that time, Atom immediately shifted to a relief center to try to help people in the community. And during that time, we served over like 15,000 families through supplies and helping them meet their needs. And that's kind of our story. Even when the COVID-19 pandemic came, we immediately got involved and we became an on-site vaccination clinic where we helped over 10,000 individuals receive vaccinations. And people ask, how'd you all get so many people when, some people were getting single digits, we were still getting 100s. And even though I think the strategic marketing that we were doing was helpful, but more so than that, I think the community felt safe. We had established ourselves as a trusted community partner. So they felt safe coming to the church, and that's why we were able to get them there. I often joke with some of my volunteers, and I tell them, I said, I don't even think people know that Atom is doing this. They're like, we're going over to the church and get our vaccination. And that's fine, because you can do remarkable things if you're not so concerned about who gets the credit. You can get the work done. So that's kind of our story. We continue to focus on a three-pronged approach: health, housing, and humanity. And that's where we are today.
It brought me back to a sentence that we always hear in the community, that you are a trusted messenger.
Yes.
So, and you say it doesn't matter who is leading this, if it's Adam or the church, but definitely you're a space, or you have created a space where people feel comfortable, will come. They can be there as they are instead of going to a place where they have to pretend that they are different people. So I think that's the key, being a trusted messenger. Definitely. And I'm surprised that when you were telling your story, so you were one of the founders.
I was one of those 9 people on the original board. Working, I was working a full-time job at that time with our local school system. So when I retired in 2012, I went back. So it was a full circle moment for me to work as executive director. And during that time, I also got a PhD with a focus on nonprofit management and leadership. So I felt like that was my calling. And I think that's important when you do this work because there aren't a lot of accolades and funds that go along with this work a lot of times. So you have to feel like you're in a space where you're supposed to be.
And in that space, you were supposed to be, but you have to be seen and heard in a very equity level. But that is something that we have known that it goes little by little. So you have been since the beginning and time has passed and you are still there. So you are the rock, one of the rock that holds the nonprofit. You were saying that you starting to come, begin like being a safe space where people can join as a church, which is one of the four T's of the churches, where people can feel comfortable and safe. Then you mentioned the COVID, but it seems to be like you are offering service. Then you
Yes.
mentioned housing. Now, what kind of changes or power are you working to build within the members of the community?
Well, one of our goals is to empower community members through education. So through the years, we've done a lot with that. The founding pastor was a prostate cancer survivor. So there was a lot done with prostate health and breast health during his tenure there. Right now, I have a focus on youth mental health.
Mm.
So I'm doing a lot with that, have a program called the Triple P, Youth Triple P event that we're doing. So from that standpoint, yes.
So you are educating people on health related not only to be protecting themselves, but sharing the information that you are sharing with them. So are you building kind of a cadence of information that they can bring to their communities, to the members, to the family members? So it builds trust from you to
Yes.
them. And how do you think is the best way to build trust within your community?
I think transparency is important, and it's also important that you keep your word. Don't make promises you cannot keep. If you say you're going to do something, then be sure you have that within your ability to do. It doesn't matter if your intentions were good. If you promise and don't deliver, then that can be seen as a negative in the community. People people have to feel like they can trust you. And back to the piece about education. So I'm an educator by profession. So that's right there in my wheelhouse. We've done things with the nutrition and health fairs and resource fairs and anything to get the information into the hands of people because education is power.
Mm-hmm.
Is power. You can't do what you don't know to do. So that is very, very key for me.
Have you seen changes that challenge you as a leader and as an organization?
I think I don't know that it's that it's a change, but it is a challenge. And I think it's one that a lot of small nonprofits have. And that is trying to determine how to meet the needs of people with limited funding. And I think funding, especially in this day and time, is a challenge for everybody, even the larger organizations, but even more so with the smaller organizations. And one of the things that I'm doing now with another organization that I'm working in, participated in a research leadership academy program through Community Campus Partnerships for Health and NCCIL. And so we got a small research grant and tried to determine what I was going to do. I ended up looking at a project that examined how small nonprofits were stretching dollars despite limited funding and still providing services. So I'm actually in the middle of that right now. And my goal is to have at the end of this report that has best practices, strategies, things that can be shared out with other organizations. And hopefully everybody can look at it and see, "Oh, I hadn't thought of that." That there
Mm.
will be something that will help people. So, but I didn't think about I could do that. So that's kind of what I'm doing with that. So I've got doing a lot of different things here, but that's a qualitative case study that I'm doing, trying to identify these strategies. So I'm interviewing executive directors of small nonprofit organizations, those with budgets under $100,000. It is interesting. It is interesting, and I'm hoping that that's going to be a useful tool once I've pulled all that together.
And you will have the best resources because you are an education. You are have been in that field. You are an educator. You know how to handle research, and it will be a product, as you were saying, and I hope it will be that it will be useful to everyone in the nonprofit organizations field because it's true. Funds, it's the heart of the organizations. Otherwise, we couldn't do anything more. It's not enough the desire. You have to have some support. But you definitely, again, you have been pioneering this and 30 plus years you're still here. So you know how to handle funds. That's a truth. There's nothing that I can say like, oh, no, 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 they have been struggling. Yes, you have been, but you have conquered those strugglings.
And through the years, I started out as one of the founder board members, but there have been several executive directors during that time period. Because as I said, I was working full time with the school system. So even during those years, I was not even on the board.
Mm.
But when the opportunity became available, because there was no one in that position when I retired and hadn't been for a while. So it was kind of like trying to revive this vision, but I knew what the vision was supposed to look like. So that was easy for me.
It was like a natural evolution for you.
Yes.
Awesome. What would you say, Miss Debra, is the greatest strength when it comes to collaboration and relationship building?
I think that would be trust. People have to know they can trust you. Building those trusted relationships where people know that I can call Debra over here. If I ask her to do this, this, and this, and she says she can do it, then I don't have to worry about that. So I think I do think that is very important. The relationships, nobody does this work in a silo, not successfully anyway. Not only takes a village to raise children, it takes a village to do the community work. And I think we would even be more successful if we could forge more partnerships and not, as I said, not worry about who gets the credit for having done it. But I believe we could be more powerful working as teams.
Definitely. And we always say at NC Counts that there's no one better than you, our members, who knows this work because you are on the ground every single time. And you are the one who gets the call and you are the one who knows the needs on each particular side of the state. Because you mentioned Rocky Mountain, which is side of the eastern side of the country, the state, I'm sorry. It might be a little different, your needs, from someone who lives in the mountains. So talking
Sure.
about trust, I think there's no better proof than said that you have trust. So, so I want to explore a little bit about how do you use the census information for the work that you do?
The census information is very helpful if you're it helps you, first of all, know who your audience is. It gives you a lens that you can look at and see what the community is you're serving. And I have used that the census data before. If you're looking at, maybe you want to do something on food insecurity or whatever, it's helpful to know what those statistics are. If you're looking for grant funding, it's helpful to be able to explain the need in the community and why you're asking for. I think the census has some very useful information helping us understand the communities that we live in.
Mm. And definitely, I can understand with that the census provide you information that makes you take like stronger decisions or well informed decisions. Because that's the thing, that if we don't handle the information that the census provided, we might be like going around the places with our head, but the census is a guide.
It
And
is.
and based on what you are saying, definitely you know how to handle that, because it
If you
gives.
want
Yeah.
to be strategic with your programming and to be sure that you're addressing community needs and not the warm and fuzzy things that we like to do,
Mhm.
the census is a good place to kind of dig in and see what those needs are. So
Facing the 20th census, the 2030, how do you feel people will react with all the changes that you as a nonprofit, we as a nonprofit haven't heard, that there will be some changes? How do you think people will react?
I think we're going to still experience a lot of the skepticism, even more so about why you're asking this. I don't think we've conquered that part, the mistrust piece from the government, because that's how it's seen. So I think that that's going to continue to be a challenge. And I think I may have even experienced some of that as I was trying to do my research and casting that net out there, asking people to. So I had to reframe the way I was asking. Instead of saying, "Do you want to?" We need research participants. No, your voice matters. So a lot of it is about framing and verbiage and all of that. Share your success, because I think people are skeptical.
So kind of humanizing the census, make them feel and see as human need, like a
Right.
person. Information matters instead of coming from the government. And
And
that will be.
yeah, even sharing, what the benefits are, people still may or may not believe it, because
Mm.
that's the society. Unfortunately, that's the society that we're living in right now, where people are mistrust information. That will be a challenge that will have to be over.
But your experience with the COVID-19 vaccination, which has a lot of backslash, a lot of misinformation, and even with that, you were successful providing 10,000 more vaccines. You have the skills.
Thank you.
No, that's a reality, because you have proved that you have helped 10,000 people or more in a matter which is very sensitive, which is health. So you have the skills as a person and as an entity to shift the message and make them feel comfortable. So if you did for the vaccines, I'm positive that you will get the opportunity to turn a little bit the wheel and have the people to complete the census, because it's very neat. They don't see that. And it's like, why me? If I don't count myself, it doesn't make any change. We know that it does. It makes a big change.
Yeah, it's just like may not be the best example, but it's like you have a pie, and instead of sharing it with 3 people, you have to share it with 25. You just get a little bit, just a taste.
A
So
tiny.
a tiny taste. So, yeah, I get
Yeah.
it.
I wanted to talk about the alliance with NC Counts. So, how has the partnering with us help advance your goals, the ideas within the community that you serve?
There are so many things I love about this alliance with NC Counts. The trainings, the monthly meetings, the resources, and Miss Cheryl Bryant, who is always thinking and looking and sharing opportunities with us. And of course, NC Counts is responsible in a large way for those vaccinations because I received several grants from NC Counts. Because before that, we were doing the work, but nobody was being paid. We were working with the health department, Nash County Health Department, and they were doing the scheduling and everything. So when I got funding, I was able to bring people in to do that and take that workload off of the health department so that they could go back to doing some other activities. So we ended up scheduling, calling. Well, the process was I'd pull a list. I decide on the target area because it was target marketing. I pulled a voter registration list and I said, this month we're going to target Edgecombe County. We're going to look at senior citizens age 65 to 80 or whatever it was. And then we created the promo and we mailed out anywhere between 1,000 and 1,500 postcards because we had this bulk mailing rate. So it wasn't that expensive. Cost us about $400-500 to mail out that many. And then that we did that the first week of the month. The second week, the volunteers started calling. They called 4 hours a day. They called, they scheduled, they followed up with those postcards. They scheduled. The last week, they called. Don't forget your appointment.
Mhm.
So it was just a process. And the month that we decided to target working people, we did a lunch. I don't remember what we called it, but it was a lunch. And we provided lunch, purchased Chick-fil-A meals. If I had a donor who gave that, purchase the meals. You come, you get your shot, you get your lunch on your lunch hour, you know. So we tried a lot of different things with that. So NC Counts made all of that possible, and I love the convenience because I always learn so much. And as a result of this alliance, I have built relationships with other leaders in our state. So it has been a great experience for me. Invaluable is how I would describe it. Invaluable experience.
Yeah, I was about to ask you about what value does this partnership bring to the communities that you work with? Because you were talking about at the beginning, we offer you funds and you were able to provide a direct service for the COVID 19. But
Yes.
what other values have we brought to you that you can transfer to the communities that you serve?
Well, as I was saying, the trainings, even
Mm.
even though, I have a degree, I continue to pick up these tools. And I've always got my little toolbox here and I'm looking to put something else in it. Like the mental health first aid training. These things that equip me to better serve the community. So, I was able to get 3 people from our organization trained for adult mental health, first aid, and youth. All of that was done. I was able to do all of that because of NC Counts. So there are always resources, even though I look forward to the monthly meetings because there's so much information there. So, and I think that makes me a stronger leader, a better prepared leader because you all are on top of the hot topics. So all I have to do is stay connected.
We were talking about the relationship. So if you have 3 words that you can pick to describe the alliance that we have with you, and if you can tell those words and why do you choose those words?
Okay. So I actually thought about this
Okay.
long and hard because there were so many. So those 3 words would be supportive, resourceful, and empowering. So as a small nonprofit organization with limited financial resources, being a part of NC Council has allowed me to connect with other individuals where I've received support. So sometimes, we just touch base on things, and share information. So supportive resources. I've been able to access a wealth of resources just because I'm connected or a member of this organization. And as I said, even though my degree is in nonprofit management and leadership, my alliance with NC Council has allowed me to grow as a nonprofit leader. So that's why I say it's empowering. So those are my 3 words: supportive, resourceful, empowering.
Thank you, Miss Debra. Thank you so much. And as I said before, we wouldn't be what we are without our members, and you are one of us since the very beginning. So before we say goodbye, is there any last message that you want to share with us? Any thought about anyone who is doing a nonprofit or anything that you want to share with us?
If I were to give a word to someone who's doing this work, I would say always put people first. Make their needs your mission. So put people first.
I love that. I love that. Thank you. Thank you very much, Ms. Debra, for sharing your story. As I said at the very beginning, before we start recording, I know you talk from your heart, and we can feel that today. I hope that you will continue leading the work that you're doing with the same passion that you have done it for so many years. And we will be here for you as well.
Thank you so much.
And for you who are watching us, we invite you to subscribe to our YouTube channel, follow us on Instagram and Facebook, and thank you for joining us, and we will see you next time. Bye-bye.